Good afternoon, everyone. My name is Elias Shaheen. I'm currently serving as FSHP President. Welcome to FSHP Town Hall number 4. We are continuing the tradition started by President Jeff Bush in the interest of transparency and keeping all our members abreast of updates and changes in our society. So I'm gonna go over society updates, and then we're gonna discuss advocacy, legal and regulatory update, as well as political action committee updates. Then we're gonna have a financial report to see the status of our society, the FSHP office staff report, and then we'll close and we'll close with remarks from past president, and we will open discussion for any questions, comments, or concerns you may have. As you know, FSHP is run by an executive committee composed of the president, President-elect Kath Baldwin, immediate past President Jeff Bush, Treasurer Shazetta James, and Treasurer-elect Dave Lacknauth. And we have the House of Delegates run by Chair Jeremy Lund, who chaired the 2021 House of Delegates, and Chair-elect Farima Raouf, who is going to chair the 2022 House of Delegates coming up in August. We have the board of directors. We have 6 members on the board that's supposed to stay on the board for 2 additional years after they serve as board elect. So we have Hoda Askari, Lindsay Childs-Keen, Nicole Reardon, Amy Rosenborg, Melissa Rubel, and then Joseph Salem. He replaced Dave because Dave decided to run for treasurer. So that left a vacant seat, and Joe Salem filled that seat. And then we have 3 board members who recently won the election. So these board members do not currently have voting rights, so they will serve as elect for a year, and then they can vote starting the next year and the 3rd year. So Dionis Malo, Stacey Maravant, and Sarah Panella. We have technician representation on the board. The current technician director is Sharita Berrios, and then the director-elect is Tara McNulty, who will ultimately replace Sharita. We have a student representative from Nova Southeastern, Jeremy S. Pute, and the FSHP board has a slot reserved for the FPA president. So Dan Buffington is currently serving as FPA president, and because of that, he serves on our board of directors. And because I serve as FSHP president, I also serve on the FPA board of directors. As you guys know, FSHP has 6 councils. The first council is a communication council under the leadership of Jonathan Richardson and Nisha Tahiliani. As the name implies, the communication council oversees the various methods of how the organization provides information and content to the membership. The Education Affairs Council, under the leadership of Stephanie Brown and Catherine Hernando. Like the name implies, the Education Affairs Council is in charge of our educational content, and the primary focus is the annual meeting, and which is in August, and we're going to have another meeting, which is the fall meeting. They are also in charge of developing content for that meeting, in addition to various webinars throughout the year. The Legal and Regulatory Affairs Council, under the leadership of Krista Riveron and Bill Kernan. So they watch for legal and regulatory updates, they follow bills, and they advocate for pharmacy practice and for increasing patient access to pharmacy services. The Membership Affairs Council, under the leadership of Irini Girgis and Yasmin Grace, is in charge of recruiting and retaining and growing our membership. The Professional Affairs Council, under the leadership of Petra Estep and Marlena Fox. The Professional Affairs is in charge of developing and maintaining FSHP administrative and professional policies, ensuring that membership is abreast of current information regarding the society and overseeing the awards. We have a technician council under the leadership of Shamel Clagett and Anesia Ellerson. So the Technician Affairs Council is in charge of recruiting, retaining our technicians and developing educational content specifically for our technicians. In addition to our 6 councils, we have 2 clinical forums. The Ambulatory Care Clinical Forum, under the leadership of Adrian DeBerry and Rachel Malta, is in charge of providing a forum where ambulatory care pharmacists in the state of Florida share best practices and develop educational content specifically for ambulatory care pharmacy. The second clinical forum that we have is the Infectious Disease Clinical Forum, under the leadership of Sandy Estrada and Ashley Kubilos, is in charge of providing a forum where infectious disease pharmacists in the state of Florida interact, share best practices, and develop educational content for infectious diseases. As you guys know, every president has a niche or an area of focus. So my area of focus is to ensure equity. If you look at this slide, it will illustrate the difference between diversity, inclusion, belonging, and equity. On the left-hand side, we have diversity. What does diversity mean? So we have people that are depicted in red, green, and black, who may not look like the people depicted in white, the big circle, but nonetheless, they're different, but they represent diversity because they don't look like the rest of the people. Now, if you go a little bit more on the right, you would see inclusion, which is a step above diversity. So right now you see the people depicted in red, green, and black that are included in the big circle, but they don't yet fully belong. But if you move a little bit more on the right, you see belonging, where those people are now part of the circle. But if you watch closely, you would see, for example, the person is in red is a little bit smaller, so he hasn't grown to their full potential. So we don't grow to our full potential unless we achieve equity, which is on the right part, where every member of the society feel like they're supported to their fullest potential. And my goal is to start planting the seeds along with my board member. And for that, we developed an ad hoc committee, is the Ad Hoc Diversity, Equity, and Inclusion. So this committee is going to be chaired by John Allen and John Clark as the vice chair. And the goal of this DEI committee is to select members representing the diversity of FSHP who are interested in serving on this committee. So the committee is going to assemble a team that will represent diversity, not only in terms of race, but also in terms of early career versus advanced career, frontline health system pharmacists versus faculty versus administrators, technicians, students, various geographic location, who truly represents the rich diversity that we have at FSHP. They're going to develop a position statement affirming the society's commitment to diversity, equity, and inclusion. They're also in charge of developing educational content to educate our members on the importance of DEI. And we're going to start hopefully assessing our baseline demographics, policies, speakers, and award recipients to see how much they represent the diversity of our members and provide recommendations to truly make FSHP more inclusive. My second goal, or my second area of focus, is to further engage our learners, students and residents, because our students and residents today are our leaders tomorrow. And that's why we definitely have to engage them in FSHP, because in 10, 15, 20 years, one of our students or one of our residents will be serving as the leader of FSHP. So for that, we need to engage the faculty and preceptors also to mentor those students students and residents. So to further engage students, residents, faculty, and preceptors in FSHP, we developed an ad hoc research committee under the leadership of Stacey Boyles and Chrissy Thornby. The goal of the ad hoc research committee is to assist in promoting research and scholarly activity among FSHP members, to solicit research proposals to advance health system pharmacy for funding through FSHP. We're going to ask the FSHP Foundation to see if they're going to give us grants where members actually can apply for grants through FSHP. We're going to develop objective criteria to evaluate these research proposals, and the ad hoc research committee is going to select certain proposals, and it's going to invite people to execute the research project, and we're going to ask those members to present at FSHP meetings. And the third ad hoc committee is the Ad Hoc Executive Vice President Committee under the leadership of Bill Kernan. So this committee is in charge of looking at potentially creating another position, another staff position for FSHP. It will be the Executive Vice President. So to assess pros and cons for that and to see the feasibility of adding a third full-time position at FSHP. So that would be like the CEO of FSHP. In addition to our 6 councils, 2 clinical forums, and 3 ad hoc committees, we have 11 regional societies that are in charge of engaging our local members, developing educational content. Most of them have a monthly meeting with their members. So those are dispersed throughout the states. And with that, I think that will conclude my section of the presentation. And now I have the privilege and the honor of presenting Kathy Baldwin. Kathy Baldwin serves as FSHP President-elect. I think Kathy does not need any introduction. All of you probably on this call know Kathy. She served as past president, she ran again, and she won. And here you go, Kathy Baldwin.
Thank you, President Shaheen. Greetings, everyone. Very exciting time of the year for FSHP and advocacy. The even number years like like 2020, 2022, 2024 brings us an early session. So the session will start in January, whereas in the odd number years, it starts in March. So it's going to be January 18th and 19th are live, and I'm very happy to say live legislative days in Tallahassee. We've been working very hard on some priority bills. We actually had one filed last week on white bagging and brown bagging. And I'm pleased to say that we brought this legislation forward, Senate Bill 748. We brought forward in conjunction with the Florida Hospital Association. When I turf this to Dave, he will talk a little bit about the 340 bill, 340 Parity Bill, protecting 340B in our hospitals, and his work with the Safety Network hospitals. There will be some telehealth legislation this year, and I'm also pleased to say that there is no language yet submitted on remote technician dispensing, which removes the pharmacist from the pharmacy and has them remotely watching the technicians. So we did a presentation that went out to everyone in email. If you don't have that, please check your email from FSHP. And there is a PowerPoint presentation in there that you can put your name on and present it to your C-suites in the hospitals. And our message there is that hospital pharmacy issues are sometimes aligning with C-suite issues. And so we want to collaborate. And I think the key in our success in advocacy is collaboration, whether it be with the Florida Pharmacy Coalition of Societies, the Florida Pharmacy Coalition of universities and university professors. So we're engaging and we're moving out of silos and we're working across the continuum. Good news there. If you don't have that FSHP email, please let Mika know and she can send it to you. It also has a big grassroots outreach in it for National Provider Status Bill. And I'm stuck here. Mika, can you move me, please? I forgot to ask you. Thank you. So we have a group, Ken Comey, who's on the line, and I don't know if Jorge is or not, who has been presenting to the Board of Pharmacy on white bagging issues. And this group, which is multidisciplinary, there's some physicians on there, were able to present to the board, and we were able to get an acknowledgement from the board that white bagging and brown bagging have safety concerns associated with them. And so regulations will be forthcoming from the Board of Pharmacy. So we're tackling this in a two-pronged approach. One is through legislation in collaboration with other groups like the FHA, and then also white bagging and brown bagging through the Board of Pharmacy. And those guys have done a great job. I don't know why I left Bill Kernan's name out on here, but I can never have a conversation about advocacy without bringing up Bill Kernan's name. At the last Board of Pharmacy meeting, Dante Kazaronian and Lilith Smith were super impressive, talking about feedback to the USP on 795 and 797. So Dante and Bill are working, and Krista, our L&R chair, are working on gaining feedback from our members, and they will be submitting those comments. Also, a very interesting comment that came up. I don't know that it's going to affect anyone in health systems, but there is an FDA MOU, and there is a website for you. And this MOU needs to be signed between the state of Florida Department of Health and the FDA. And if it's not signed, which is what we are anticipating the outcome to be, then there will be compounding limits for those pharmacies who send compounded drugs out of state. So if this affects you in any way, we'd like to hear from you and get you into this loop. Mika, if you want to go ahead. Our national advocacy. This, in my mind, is the biggest, national provider status is the biggest bill in my 36 years of being a pharmacist. I am doing a presentation on what it took for the other providers that are mentioned in the Social Security Act. We know that PAs got national provider status in about 7 years, nurse practitioners, 35 years. So that presentation will be forthcoming. But this will radically usher in the paradigm shift to sustain new models of pharmacy, including clinics and ambulatory clinics. It will less impact me as an ICU pharmacist because of DRGs. However, the job market will be explosive for high-level, highly trained pharmacists. And so please join us in that grassroots. There's also 340B protection at the national level, and those are the bills there. We are requesting that our congressmen and our senators, Rubio and Scott, request that HHS acts against manufacturers who fail to comply with the 340B program. And there's been good reporting from ASHP on that. ASHP is leading these charges. Interestingly, as I go through this presentation on national provider status, all the people who have gotten the dietitians, the certified nurse midwives, the PAs, the nurse anesthetists, every social workers, certified social workers, they all have one thing in common. And that is they were able to gain national provider status through national societies. So ASHP is huge and paramount in this legislation. If you want to go to the next slide, Mika. Again, the presentation will go through how all of these groups, what they had to do and what lessons were learned because of what they experienced in their trek towards national provider status. Next, please. So again, we also have another very large bill up in Washington, D.C., and this is about direct and indirect remuneration reform. And just very briefly, direct and indirect remuneration was originally part of the Affordable Care Act and Medicare D, where pharmacists would dispense a medication. They would hit all 5 stars, cholesterol had been checked, depression screening had been done, and they would get an extra bonus. But our friends, and I'm using that term loosely, at the pharmacy benefit managers, do it instead as a way to pull back or claw back money from pharmacies. So this affects you if your health system has an outpatient pharmacy. And just a reminder, last chance on CE, on collaborative practice agreements. So go ahead, Mika. And so now I'm going to turf it to our new Political Action Committee Chairman, Mark Mchale.
Well, thank you, Kathy, and good afternoon, everybody. All of those wonderful things that Kathy just described, that all the committees and all the wonderful advocates have been working on, they take dollars. And whether right, wrong, or indifferent, that is sometimes the way that the political system works. So I'm super excited. Thank you, Kathy, and thank you, Bill, having some pretty big shoes to fill to take over the PAC committee and continue the great work that they started. Very thankful. Up on the screen, you can see all of the PAC advisory committee members. We're looking forward to a very successful year. And, usually this part of the presentation, there's a call to donate or for money, but I really wanted to say thank you. It's been, as Bill and Kathy have turned over some of the responsibilities, I get to see the donations as they come through. And I am so actually overwhelmed at the generosity and the advocacy and the passion that so many people on this call and through the society have for our legislative change. And so when I took over as PAC chair, we reset the clock to $10,000 with a goal of $50,000 for the year. And I'm happy to report that we're actually at $28,000. I just checked it this morning. We're at $28,000 already in the PAC. And that is a fantastic number and a true testament to everybody's dedication and passion throughout FSHP. And so my call is to this, because I know many of you that are on the meeting today are monthly contributors as well as one-time contributors. If you're a one-time contributor, make it a monthly donation. But I just want every person who's a donator to find one person who is not, and let's get them to donate and be a monthly donator. And we just double that number. I remember a statistic from the FMA. They typically at their annual meeting will raise somewhere between $300,000 to $400,000 for their PAC. And we're gonna get there. So excited, we're gonna meet next week as a PAC committee. We're gonna come up with some nice and exciting ideas for the annual meeting to help to continue to raise those funds like we've done in the past. But really just my message today is you guys are awesome. It is amazing to see the level of commitment that you guys bring and will continue to bring and has continue to grow so that our advocacy can be recognized and continue to move forward through all those passions. So that's all I got, and it's a pleasure to be with you guys today. Thank you. Back over to you, Kathy.
Thank you, Mark. We are so grateful that you stood up and took this on. And we can't thank you enough. I did forget to mention something, believe it or not. So I have a message from Bill Kernan that FDA draft guidance on interpretation of 503A statutes to hospital sterile compounding. And this is guidance. It centers around anticipatory compounding or mixing before an order. And FSHP is gathering comments from its members to submit comments to the FDA by December 6th. So that is hot off the press. And the interesting thing about legal and regulatory is that it's constantly changing. I also want to mention one more thing. We have reached out to all the students at all the schools to provide them with an understanding of advocacy, an Advocacy 101 presentation, which we do every year. So that is in the process of being completed now. Thank you again, Mark. And Mika, if you want to move us forward, I'd like to introduce Dave Lacknow, who will give us our FSHP financial report and a brief update on any legislation that's for the state on 340B. Thank you.
Hey guys, so I'll start out with the transition of where Kathy left off on the legislative update, then I'll jump into the financial report. So last week I had the opportunity to go to Tallahassee. I went up there with several folks from the safety net hospitals wearing the safety net hat. Of course, I'm always have the FSHP hat under the safety net hat. So luckily I was able to kind of give multiple perspectives in that advocacy approach. So what we did in Tallahassee was really socialize some protective language around discriminatory practices against 340B entities. The goal was do not pay an entity less money on the sole basis that they're 340B. Do not increase administrative burden on 340B pharmacies on the sole purpose that they're 340B. And don't ask 340B facilities to start sending more information in every prescription, increasing administrative burden because we're 340B. So we framed that up in those bullet points. We also partnered with the FQHC advocacy group. So the safety nets and FQHC kind of sat at the table together as we have common goals and kind of really socialized to several senators and several House members what 340B is, because it could be very confusing, the why we need to preserve it, and how this is impacting and helping us reach and improve patient access to drugs. In addition to that, we also met with the governance body over health plans. And that was strategically done by the safety nets. So the plan groups are not surprised when we show up in Tallahassee with the protective language. By the way, Kathy, the plan group did say, what's that white bagging thing that just got filed today? We were in Tallahassee when it got filed. And they were actually very receptive to it, because they said, hey, we also don't want this sitting in the trunk of a car or the drug to not be effective because it didn't go to the primary pharmacy. So I think you've got some, again, socialization of understanding of the safety impact and access impacts of white bagging that Kathy mentioned and 340B. Right now, we're working on getting a representative to sponsor the bill on the House side and the Senate side. The safety nets are strategizing that right now in collaboration with the FQHC groups. And hopefully in the next week, we'll get something out there that we can get a House member to support and put into bill writing for us is the goal. Kathy, I think that's the high level update of where we are right now in 340B, and we'll continue to be aggressive about that on both fronts for the Florida Society of Health System Pharmacists, in addition to our safety nets and other providers that are 340B entities throughout the state of Florida. The next thing that I have, the third hat I'm going to wear is the treasurer-elect hat. So being treasurer-elect, I'm going to give you guys a quick overview of what our finance has been trending over the past few months. Internal audits, we have a few slides about our internal audit process in the last few months. External final audit, of course, once a year, we try to have an external company and do an audit. That's in progress. There was a process where they needed some more information. That information was provided. Now we're waiting for them to validate and come back with the information. We think that's going to be pretty successful when we get that data back, and of course we'll get that out to the group. Did you, for annual meeting projected registration and exhibits, Tamika, I'm going to lean on you on that. Anything specific there?
I can go into it once I get down, but
Okay.
just the check plus is a good thing on your end.
Got it. And the on track to make a profit this year. And can we jump into the monthly financials? I think that'll be the bread and butter. So we're going to look at 2 months. We're going to look at August and September. When you guys look at August, I need you to really kind of understand that August has most of our expenses and most of our revenues because the annual meeting is in August. I'm going to work this report from top to bottom on what I think is very important for you to see. If you look at assets, the first section, you scroll the way down to TIAA bank checking. 773,000 in there. So that's cash on hand. That's in our checking account. That's cash on hand, right? We're going to have to live off of that cash on hand for the rest of the year, but I want to highlight that cash on hand. The items below it are investments, dollars we have in investments, and those investments are reported. So you could see that those dollars are there and they're being audited to make sure they're there, and adds up to total current assets. If you, again, I'm working my way from top to bottom, you see the line that says total current assets. Total current assets, which includes the cash that I mentioned above and our investments at 1.56 million. So that's current assets for the organization, 1.56 million. Work our way down again to total asset line. The total asset, again, is slight difference, but 1.56. Next thing of the equation, we show assets and then we show costs. So what kind of costs do we have? That's in the liabilities and equity section. I'm going to work my way again from top to bottom of that section. And as you could see, total current liabilities, 162,334. August is a heavier liability month because we're paying for a lot of the annual meeting expenses. So it's not your typical month, but you'll see more expenses spent in the month of August. And then I'm again going to work my way from top to bottom on this. If you take the 1.56 million I mentioned in total assets, and then you subtract out the 162 of cost, leaves us with I call it a bottom line of the 1.561 million for the month of August. Can we jump into September? Very similar format. I'm going to work top to bottom again, but I'll be more brief on this one as you guys can have already gone through the first. Again, I'm going to go back into now the September month. I'm working from top to bottom in the asset section. I'm going to work my way down total assets of 1.412 million. You could see in the cash decreased slightly because of our expenses at 634,000 as per the expense from prior month. So 1.4 total assets. Scroll down again, Tamika, to the liabilities. Liabilities for the month. Look at total liabilities line. If I'm working top to bottom, it says total liabilities at 36,376. That's your typical monthly operating cost, right? So that's a non-annual meeting cost, which leaves us at the 1.412 million for total. And again, our annual meeting is a lot of the revenue we're getting and looking to carry us through the year. If you extrapolate a 36,000 out times 12 months, at the end of the year, we should close the year out, I think, up roughly about 120 to 140,000, closing the year out, keeping our budget in line. We should be up, I think, about 140,000 as this report reports out at the end of September. I'm going to pause there and kind of say, this year has been I think a year where we've been foundation setting. And I think we've built a nice foundation where we do have positive foundation to build on financially. And I think what we're going to do as we continue to be creative in this process is be very strategic in what we spend our money on. We're going to make sure we're not overspending and spending on what's needed. And I think the entire executive committee is very frugal. in making sure we do that in the right way and seeing it. And secondly, we're going to continue to build on that because we also want to build revenues within the organization so that we can continue to expand our influence within the healthcare arena. So again, I'm going to hand back over to Tamika after these two reports, and you can kick it back to me if you'd like. I'm okay with that to maybe go through the other slides, unless there's another financial report slide for me. I think those were the main ones.
So hello from Tallahassee and from your office staff. I'm Tamika Bennett, Operations Director, and Brooke is in one of these boxes somewhere. Brooke, wave if you're there. So we just want to say hello. We know you guys only see us a couple times a year, so the town hall meetings give us an extra opportunity to say hello to our members. So I just wanted to give you guys a brief update on some of the things that we're working on here in the office. One of the more important things, of course, is our membership. We are currently in our membership cycle. The January cycle started September 1st. Brooke sent out a notice on yesterday, which is our 60-day notice to our members. If you received that email, she drafted it perfectly wording. Let's get it off your plate now so that the holidays come and it's one less thing that you have to worry about. So those are some of the things that Brooke is good at. She's good at reaching out to our membership and making sure that all of your membership questions are taken care of, renewal. Those of you that are in group and discount renewals, go ahead and get that group together. Go ahead and remind your employer that it's time now to get those group discounts paid. And if your employer won't pay, we do have another discounted rate where if you can get at least 25 pharmacists that work in the same health system or same facility, that we will be able to do a discount. So contact Brooke. Her email address is on the screen. It's brooke@fshp.org, or you can contact me at tamika@fshp.org. But both of us are very willing to help you when it comes to our membership. Just a brief, just throw out some numbers for membership. We're doing very well considering and looking at our comparison of other associations. We're currently at about 3,100 members right now. We have almost 1,500 pharmacist members. We've got about 450 tech and about 850 students. So again, we're doing well. As we get closer to the end of that cycle, we will have some of those members fall off, but we want to try to deter that, to just keep encouraging our members to renew before the end of that cycle. So that's our update on membership. One of the great benefits of being a member is also having the opportunity to mentor or be a mentee. And I'm pretty sure that a lot of you on this call have participated in the mentor-mentee program since we developed it a couple years ago. But if you have not, here is your opportunity. Email when I want to say a couple weeks ago. If you didn't get it, please email Brooke, because this Friday, November 12th, is the deadline to sign up to be a mentor or a mentee. So please, please take advantage of that. We have a lot of students who are interested in what is going on in the society, and we feel like you guys that are here are great leaders and can mentor them in this profession. So again, if you have any questions, you can reach out to Brooke to get that link. But remember, this Friday is the deadline to sign up. Annual meeting 2021. Very scary times, but we had it, we were there, and we want to say thank you for everybody that supported us in moving forward with the meeting. It was a great meeting. We ended up with a total of 739 attendees and 95 exhibitors. So Dave and Sharzetta will probably give the nod and the thumbs up that we are on the up end when it comes to what our bottom line looked like. That was not a major factor, but we wanted to always make sure that we have a great meeting, great networking, and this year we focused a lot on safety due to the current situation. So it was a successful meeting. So we want to thank everybody, all of our members that supported and attended. I know it's still 2021, but we are well underway planning for our annual meeting for 2022. The FSHP annual meeting, and I know we have Stephanie Brown, our Chair of Education Affairs Council, on the call, and the committee or council has settled on a theme. Together Towards Tomorrow. I think it is an excellent theme, and we will be working on getting all of our continuing education tracks together. Again, we never stopped planning. Once the meeting was over, we jumped right into planning. Thank you guys for completing the needs assessment. It is very important as we plan our meetings. We also will share that information with some of our regionals to help them also plan for meetings. But Together Towards Tomorrow, annual meeting 2022. Save the date, August 5th through the 7th, 2022. We're going to be at Disney Swan and Dolphin, and we're going to be in the Dolphin side. So go ahead and make those plans. I know my kids are excited. Those of you who have kids, grandkids, it's going to be a great meeting. We're already speaking it, so make those plans to be there. I can't wait to see you all. If I don't speak to any of you prior to today or see you guys, wishing you all happy holidays. That concludes the office report. And I would like to introduce someone else who probably doesn't need much of an introduction, which is our immediate past president, Jeff Bush. Thank you.
Hi, everybody. And to me, I get the easiest part of the whole presentation because I get to talk about what bright future we have going forward for FSHP. So, one thing that we have to understand is that when we decided to go into pharmacy school, we entered school, we graduated, and for those students on the call that are still, working towards graduation, we all entered into a profession. And regardless of when we graduated or looking to graduate, this profession has evolved so much. We have done, we've evolved because when you talk about pharmacy, in the past, it was always related to a product. We always delivered a product. We dispensed medication. Well, the field now is evolving to more of a team-based care. We are trying to go into our cognitive, what we've learned, what we have used. There's been a lot of pharmacists before us that's worked hard to go ahead and let us practice at the top of our license. We did get collaborative practice. We are now looking to, do immunizations. So, as the profession or the field of pharmacy expanded, that was one of our goals, is for FSHP to stay relevant within this profession. And, we're doing that. If we look at, what President Shaheen said, and one of his goals was to really take a look at diversity, equity, and inclusion. We needed to have an understanding of the vision that we have as a society when it comes to diversity, equity, and inclusion. The next thing I wanted to say is when you talk about FSHP and Tallahassee, it's a strong society. And that really has evolved a lot about the work of Gray Robinson. We have two of the strongest and best lobbyists that you could ever ask for, and that's Joseph Selvage and Reeve Harbison. They really have gotten, I would say, our name to the top as to, the highest level that we can be known as to a society. Next thing is, and Kathy touched on this, with the great work of Jorge and Ken and Bill, we now have a strong and constant presence in front of the Florida, Board of Pharmacy. We had a simple ask when it talked about white bagging and brown bagging to have a simple ad hoc meeting to look into the safety concerns. And we got it. And the three of them have really, and Dr. Diaz as well, have really hit the ground and really shown the importance of our concerns when it comes to white and brown bagging. Again, as we've tried to, expand the scope of FSHP, with the new vision and mission statement from 2 years ago, we wanted to expand into areas that we don't see a lot of involvement. So, now we have the Research Ad Hoc Committee. really like President Shaheen has said, reaching out to these faculty, reaching out to students, reaching out to residents. We do great data collection as pharmacists. We can tell you all about the data within our health system, but we don't do a lot with it. We've got to show the power of what we do, especially through research. So this is really exciting. And again, expansion of FSHP. So as Kathy talked about, collaboration is the key. And this is something that we have done a lot of over the past couple of years. Again, trying to work strongly with FHA and FPA on white and brown bagging, but also working with FPA on trying to advance our pharmacy technician role, trying to get national certification as well. And again, with the 340B and national provider status, working alongside of ASHP. You know, one thing that we have to understand is when we enter into a profession, the best way to give back to our profession is to get involved. You know, you have to get involved within FSHP. You have to be able to help PAC, because none of legislation or none of the movement that we want to move our profession forward is going to happen without money. And I know that's sad. So really think about a PAC donation, really think about getting involved to, you know, a council or just going to the annual meeting. Let us hear what your voice is saying, you know, because every new day brings on a new horizon. And I am so happy and excited about passing the torch to President Shaheen, our new executive committee and the board of directors, that I know we will continue to build on our future, and our future is really, really bright. And for that, I want to say thank you for all your support. Don't let it go. We need that support. And at this time, I'm actually going to pass it back to President Shaheen.
Thank you so much, immediate past President Jeff Bush. Thank you so much for your mentorship too. And I will open it up to any questions, comments, or suggestions you may have. You can either type your comment, question, suggestion in the chat, or you can unmute your microphone.
Hey, if everybody else is shy, this is Mike McGee. I'll ask a question. So I don't know if I heard much about pharmacy technicians and the severe shortage that we're experiencing throughout the state. And I just wanted to know if there was some activity that FSHP and or the membership can pull together to help support some initiatives related to that, you know, what we're experiencing.
You know,
If I
Mike,
may-
this is Jeff. Go ahead, Kathy.
Oh, I was just going to say, Mike, you always bring such pertinent and important information forward. I just read in an ASHP journal that John Armistead started, I don't know if John's on the call or not, started his own technician program at Lee Health, and it was highlighted. And it got me thinking that, you know, we really need to promote this within our health systems, because we're in dire straits with technicians and not having enough of them. So I don't think we have anything, let me rephrase that. I know that the technician legislation on immunizations is coming back again this year. So we're expanding roles, but we're not meeting up with the need. But I think it warrants, as you said, is a deep dive into that. But I've been thinking about that article for some time now. And I'm thinking we may need to start training our own people from within our systems.
So John has definitely been on the front end of this, but there are other health systems that are doing training programs as well, Baycare being one of those. And so, and we're also paired up and partners with like Pinellas Technical Institute. It also has a training program. It's ASHP certified, but I think beyond that, it just seems to me like that workforce issue, I don't think it's going to go away anytime soon. And it's going to have implications to our practice models and to what pharmacists do day in and day out. So I don't know if there's anything legislatively or what we can do, but I really feel like the think tank and our FSHP has to lead the way of trying to figure out exactly how we get out of this box, or whether or not we figure out how to adapt. I heard somebody talk about, the arms race. It's like an arms race as far as salaries, but that's self-limiting, I think. At some point, we got to figure out a better way to do business, and I don't know what that might be yet. So I haven't figured that out. But anyway, just some food for thought on the tech side.
If I can share briefly something that we've done in the interim until we figure out the longer term strategy, we have evolved our pharmacy tech development program to initially have employees who were a part of the organization, not a part of the pharmacy department, to undergo the training for a small fee that was very competitive, just below the community college rate in our area. We have gone ahead and removed the fee, and we've tried that to try to encourage a higher enrollment. And as of recent, we, in addition to not having a fee, we'll actually be paying individuals to be our employees, be dedicated to the program. As they train and study, they can have a source of income and then be able to transition into the pharmacy tech role. So we'll see how that continues to play it out in our program.
Yeah, that's excellent. So Baycare, we're doing something very similar to that. And the challenge that we hear, though, is that those entry-level positions, we used to be able to basically recruit from places like dietary or environmental services, and this was like a move up for them. Now, because of the compression of the $15 an hour wage or $16 an hour wage, it's all gotten so compressed that it's almost as if that's really not a huge boost to these people. And so it's just a very interesting dynamic right now. And even those areas within our health system are a little bit sensitive about us going out and trying to recruit them, because they're having labor shortages as well. So it's just a very interesting dynamic. I don't think we've ever seen. I've never seen it in my career for pharmacy techs. That's a really good. That's a good program, though, Jorge. Thank you for sharing.
Mike, I'm wondering if maybe we need to get involved with the tech schools and maybe even go to the high schools and talk to the students about technical jobs like pharmacy techs. I'm just thinking out loud now with you.
I think, Kathy, the one thing that is an area of opportunity, Florida is a transient state. We have people moving into the state from all over the country. One of the areas of opportunity that I see is we've got a process for pharmacists to reciprocate to Florida, not so much technicians. So as people move down to the state and they take part-time jobs from other states where they've proven they have years of experience as a pharmacy technician, it seems pointless to make them want or go through another training program that's been accredited by the Florida Board of Pharmacy. And I think maybe we need to take a different look at this and say, this is going to be a patient care issue within our communities, because we're right on that cusp. And how that will relay to poor patient care in our communities, which is, that's who the Board of Pharmacy really protects, and that's who they serve. So I think we probably just need to take a different angle to that and just kind of explain that process so that we can open those doors for reciprocation.
I think that's an excellent recommendation. I think also having a multi-industry stakeholder approach to it, understanding what community pharmacies, the large chains are doing. When I was a high school student, Walgreens gave me all the tools to become a licensed pharmacy tech. They gave me the classes in a Walgreens store. I think they're moving to some of that again. So maybe trying to understand what are the strategies on that in the community pharmacy setting. The more stable that labor force is, the more stable we could be on the health system side. So looking at, FSHP and a potential approach there that goes beyond what we could do in the health system setting.
So
And I'd like to read a comment from Anisha Ellerson, who is the Vice Chair of the Technician Affairs Council. She put in the chat. Anisha, I don't know if you can speak or not, but I'll read it and then you can jump in if you like. She said that's one of the problems that will continue. It's not a money issue, but there is really no benefit to being a technician at this point in the state of Florida. We don't have any benefit for the time we put into the certification programs.
Hey, Mika, can you hear me?
Yes.
Cool. Yeah, I'm listening to you guys, and the shortage, I hear about shortages every day, and because I work in the health system. But my question is, I wonder what is retail doing differently than the health systems are doing, how they're retaining technicians, how they increasing their technicians, because I look at just locally for Walgreens, they're not experiencing as much of a shortage with technicians as the health systems are. And what are they doing differently than the health system to retain technicians and to keep them growing? I know, like CVS, one of the things that they do is that they encourage certification and they reimburse certification and they give you a benefit from being certified. And the health systems don't. Most health systems, I'm going to say minus Mayo at this point, there's no benefit. We're spending a lot of money to become a pharmacy technician, and you're barely making $15 an hour. And if you're single, you really can't afford to live off of that. So you automatically say, hey, I'm going to go be a medical assistant. I'm going to leave pharmacy tech and become a medical assistant. They're going to pay me a little bit more. And then there are travel opportunities and more opportunities for you to do more. So they tend to come be a pharmacy tech temporarily and become a medical assistant, and they're out of there. So that's just my thought.
Yeah, I think that what I'm listening to the comments, and I think everyone knows what it is. There's a compensation gap in the skill sets we want and kind of what we need. And I think what Jorge talked about at Baptist and Mike talked about in his policy, I think those are strategies that are going to hopefully start increasing rates. But let's face it, in this marketplace today, it's market. And you can be an Amazon driver and get paid a lot more money than you can being a pharmacy technician compounding chemotherapy in our health system. But there is a compensation gap. And I'm seeing that folks are leaving the profession and going into fast food pays more than our minimum wage sometimes. So I don't know that we as an organization can control compensation. I think that that's more so handled at a health system. And as we benchmark against each other, we can start to raise that market rate. But I think that takes time.
Dave, I want to take that opportunity to say congratulations to you for being appointed as a board member on the National Technician Certification Board. So congratulations, Dave.
Yeah, no, thank you. I just got appointed for the Pharmacy Technician Certification Board as a board member. So part of our advocacy there, and I've already had conversation, is how do we create specialty pharmacy technician roles to kind of create some differentiation? Because I think that mid-level pharm tech role could also lead to better compensation. So I'll just add that in because it was a topic we're talking about. But I think all of those strategies need to come together to eventually get these guys compensated the right way.
I'm going to ask if Jeff Bush, are you able to talk?
Yes, I am.
Okay. Do you want to talk about the technician legislation? I was remiss in this, and I'm glad we're having a moment here to talk about it. Do you want to take that?
In regards to what specific?
Every year we ask the Tech Council, what would you like to have done legislatively, and what they decided?
Yes, really what they wanted to go ahead and fight for a national certification for the state of Florida. And, one of the reasons, and I wouldn't say a main reason, but, when we tried to get the vaccination legislation through last year, where we were going to have the technician the ability to continue to vaccinate, the chair of the committee came right out and said, well, technicians aren't really, what's the word I want to say? Aren't really certified, or they don't have the ability or the training to do something like this. And she was very vocal. So in our conversation, and this has been a collaboration with FPA, you know, how could somebody say that if they are nationally certified? So that was really one of the driving forces in which we thought we would fight this year. I think one of our problems last year is we went after way too many things for technicians, but now getting one voice and in line with FPA, I think we'll have a good situation where, you know, we would be able to get a national certification bill for Florida. The other thing is I have been going to the Board of Pharmacy meetings, and one of the board, there was a technician trying to move from Colorado to Florida, and she had been practicing for almost 20 years and was denied the ability to really practice as a technician unless she went through one of the certification courses. And, you know, that is sad, and that is something I think we do need to fight for. And I will say, in one of, you know, in my health system, we finally did notice, I would say identify, where we don't have a ladder for technicians, you know, but we're asking technicians to do a lot more, med rec and stuff like that, but there's no, you know, technician 1, technician 2, and there's no incentive for a technician to really look in the future and see, you know, there's no ladder, there's no, they see pharmacists moving and getting, you know, reimbursed for certifications, but we didn't have anything for technicians. So that is in discussion. So I think that definitely moving forward will help as well.
And that would allow for reciprocation for what Dionys was saying.
Yep.
Thank you.
Hey, Kathy, you know, that's actually true here at the facility I'm at. I had the conversation because I think it's probably 4 technicians that are certified, and I asked, why are they not certified? Well, they don't reimburse us. They have reimbursement for pharmacists and pharmacy students, but they have nothing for technicians. So there's nothing that will motivate them to want to actually excel in their field because there's nothing there for them. And as far as you can go in this particular organization is at this location is to IV tech. And to me, an IV tech is average. You know, it's not really a benefit just to be an IV tech. That's the easiest thing that you can go to after being a runner, delivering medications to the floor. It's a natural assumption that you're going to become an IV tech next. But there's only like it's a 60-cent difference between a runner and an IV tech. Where's the benefit? There literally is nothing there for you to do, and there's no reimbursement. And when you ask why there is no reimbursement, well, none of the techs want to become certified. Well, it's because there's nothing benefiting them to become certified. There's no difference between a non-certified tech and a certified tech.
Thank you, Nisa. I think, Mike, you hit the nail on the head. We've got a big can of worms that's open, and we need to divvy it up and figure it out. So, Dave, do you feel like putting a 4th hat on?
Yeah, I think you know what, I'm hearing a lot of good information here with the need. I think it's multifaceted, right? I think we could make recommendations. I think we could probably start to spin something out of this, Kathy. And of course, I'm integrated with PTCB, so I could leverage that a little bit too to take any knowledge and bring back to the state level too. So, honestly, it's one of those things that I'm thinking out loud. I always try to find answers to things, but I think this is really an evolution in our profession today, and the evolution, unfortunately, will take 3, 4, 5 years. And I hate to say it, one of my hospitals started using agency pharmacy technicians at triple or quadruple the normal tech rate. And it may take my health system to pay a big chunk of money out before they realize they need to increase pay in general across the board. and you guys know in your health systems that that's kind of the balance of the seesaw. So Kathy, we maybe take it back and to our executive committee, and then we can talk through what we think we can do to maybe frame something up to keep
Yeah,
this
I
in.
agree. I'm thinking a position paper and maybe getting with key stakeholders to move this forward, because undoubtedly, as we get provider status, technician roles are going to become bigger and bigger. So we've got to resolve this. Thank you, Mike McGee, and everyone for your comments.
Yep.
Back to you, President Shaheen.
All right, thank you, Kathy. So in the interest of time, I'm going to ask Kathy and Jeff to take it back to the technician and to the legal and regulatory to work also with Dave on figuring out the best way to proceed with this issue. I want to also thank everyone for participating in this FSHP
I think we lost your mic, Elias.
All right, I'm back. Yeah, I just noticed that. So I would like to thank everyone for participating in this FSHP town hall, and I will see you after the holidays. Happy holidays, everyone.